Good morning and welcome to the third hour of Kenya's biggest conversation, the Situation Room. This morning, let's begin the hour with the day's proverb, Siti Muga.
One does not enter the water and then run from the cold.
One does not enter the water and then run from the cold. Ukiavulia yaoge. Okay.
You know, anyone who's never experienced taking a bath in a river may find this a bit alien. Because if you remember, Lou first talked about, well, you know, when you enter a bathtub. This isn't bathtub arena.
You have to specify. You said
Yes.
water, man.
Yes. But even if you think of a bathtub, the truth of the matter is the moment you emerge from the water in whatever, somehow there'll be that cold sensation.
Indeed.
Yes. But as children, it's something you enjoyed.
Yep.
Sitting there shivering.
Yes.
If you've committed to something, see it through.
Please.
See it through. Don't complain about it.
No.
Okay. We have committed to many things and want to welcome our guests now in the show. We have a number of guests on in the studio and joining us via video link. Let's start with the one in the studio, and this is Dr. Willis Akhwale, the chairman of the COVID Vaccine Deployment Task Force. Good to have you again in the show, Doc.
Yeah, good morning and good morning, Kenyans. I'm happy to be back.
And we want to say a very good morning as well to those who are joining us now on KTN Home for the next 1 hour. We want to have a conversation about the national vaccination campaign for COVID-19. Kuwa shujaa, pata chanjo, tufungue nchi. That's the theme, right?
Absolutely.
And that's the campaign that you're running.
Yeah.
Before I introduce the other guests, maybe you can just tell us about why this particular line, pata chanjo, tufungue nchi.
Yeah, as you know, the aim of our vaccination program is to vaccinate as many Kenyans as quickly as possible so that we start looking at the aspects of life and in particular the economy that has suffered a lot under this pandemic. We strongly believe that the more people we have vaccinated, the more the impact of the pandemic will be, and therefore the possibility that we open our economy. This pandemic has almost enslaved us because of the impact it has had on our economy. So we looked back at the freedom fighters who came out and really said we must get freedom to do what we want. So by getting vaccinated, we are really doing what
We are securing our freedom.
Yes.
And the program is still on course that we want to have 10 million vaccinated by December?
Yes, and I want to really clarify that because people should not be confused by targets. Our target is to vaccinate the entire adult population before the end of next year. Then we have another target of this year, which is 10 million.
Okay.
And for us to be sure we are on course, given that in the last few weeks we've now got enough doses, 6.5 million doses are already in this country. We strongly therefore believe that we could hit the 5.8 million on Mashujaa Day.
Okay.
Yes.
So 5.8 million people to be vaccinated by the 20th of October. In the next 20 days.
In the next 20 days, vaccines administered.
Okay.
And where are we right now?
We are at, this morning I've seen we are very close to 3.8. We are 3.77.
Okay.
Okay, can we ask then the structure you put in place to ensure that you get as close as possible to this target or to even surpass it?
Yeah, we are going to use three main strategies, and one of them is just to increase the number of vaccination posts. Kenyans may have known that we had only 800 vaccination posts when we began by beginning of July. And at any one time, because of vaccine shortages, only maybe 200 were actually administering the vaccines. Now that the vaccines are there, we've discussed with the county governments. We've told them to give us lists going up to level 2. That is even those posts that are really close to people to be among the 3,000. So we are increasing up to 3,000, the number of vaccination posts. So that's one strategy, geographic access. The other thing we are doing is outreaches. And yesterday you saw the cabinet secretary in Kiambu launching outreaches that will be conducted, targeting the elderly people, targeting areas with high populations, so that we are again as close as possible to them, using community health workers to identify populations. And the third one is just the communication campaign.
All right. I want to bring in the other guests into the conversation as well. Dr. Joseph Mbai is the CEC for Health in Murang'a County and is also the chair of the CECs for Health caucus in the country. And we're also joined by Dr. Samuel Mwenda, who's the chair of the Kenya Faith-Based Health Services Consortium. Dr. Mwenda, starting with you, very good morning.
Good morning.
It's good to have you on the show. And you represent the Faith-Based Health Services Consortium. Just for clarity and for everybody to be on the same page, who are those?
Thank you. The faith-based health service providers have been key stakeholders in health service delivery in Kenya. And the main players here include all the churches that provide health services. We have the Protestant churches, we have the Catholics, within the Protestant, we also have the Seventh-day Adventists, we also have SUPKEM, bringing on board all the Islamic affiliated facilities. We also have Mission for Essential Drugs and Supplies, which is a supply chain that supports and complements the delivery of essential medicines across the country. So this being the major player in health service delivery, in training of health workers, and also supporting access to essential medicines across the country.
So relative to this particular campaign, I'm then to assume that what you're saying is that all these faith-based health facilities are offering their facilities and their work and their staff to vaccinate the people.
The faith-based health service providers provide services complementing government services, and we are part of the National Health Service Delivery System, playing all the way from the national level to the grassroots, being part of the county health delivery structure. So we provide essential services that are recommended by government of Kenya and by WHO. We've been immunizing children, for example, across all our health facilities at the various levels. So this being a very essential service, we are prepared and ready to be part of the immunization process, just like we are part of the COVID management health system.
Dr. Akhwale, we've seen recently, in the last maybe 2 or 3 weeks, that we've seen other institutions then sending out or broadcasting messages that there will be a vaccination drive in this church or there will be one in this school. Is this part of this effort, and is it a joint campaign to get more vaccinated?
Absolutely, it is. It's a joint campaign. In fact, I'm happy Dr. Mwenda and Dr. Honorable Mbai are here, because about 3 weeks ago we had a meeting with the Interfaith Council, and they offered themselves and said we want to support this. They were concerned that the political class was not talking about COVID. They told us they were very concerned with the deaths that about a month ago that were occurring. And then about 2 weeks ago, we were with Honorable Mbai in Nyeri to really now plan how the counties can really own this. Because right now, vaccination as a service delivery is a function really of the counties. So we believe the next phase is going to be driven a lot more by the religious leaders and the county governments and the communities. That partnership, everybody playing their part, will be very key.
And one of the things then has been access to information that we then see in the different groups that we are in, that folks are asking, so where can I get a vaccination today? Where in my area is there something available? Will there be, or is there currently, and perhaps we do not know, a list of where, if I'm on Mombasa Road today, for example, where can I access vaccination in my vicinity? Is that information being made available?
It is going to be made available. We are refining it a little bit because remember, these facilities, it is the counties that identify them. So currently we've told the counties, give us the list for expanding from 800 to 3,000. Why that is important, because we want to be sure that those facilities have the necessary infrastructure to vaccinate. We do not have maybe people putting facilities that don't exist. So the counties have really to own and tell us these are existing. The other thing we are looking at is that the people must have been trained to administer the 5 types of vaccine that we are administering. Now, once that is completed, and I want to really push it for next week, then we are going to put it on our website. But that is one. For me, more important at the market level, at the lower levels, we've had discussions that we want to brand a lot of those, so that as you are walking, you can see this is a vaccination post. Within markets, there are banners telling you vaccination is taking place at ABC and D.
Please go ahead, Eric.
Let me bring in Dr. Mbai. Dr. Mbai is on the line with us. And Dr. Mbai, like you said, is a CEC for Health in Muranga. He's also the chair of the National CECs for Health Caucus. Dr. Mbai, much of this load is going to be on you and your fellows at the fellow CECs at county level to make sure that as many people as possible are able to turn up for the vaccines, and also to make sure that as many facilities as possible are available for people to turn up. When you're talking about looking at vaccinating 2 million people in 20 days, that's a huge number.
Well, for us in the counties, actually, we are prepared, and what actually is happening is that the counties now are identifying the vaccination centers that they really need to upgrade so that we can be able to have more vaccination centers. Initially, we had a few, but with the team of Dr. Akhwale in increasing the availability of vaccines and also advising us to scale up, we are now making sure that all the health centers, especially where we have more than one nurse, they become vaccination centers. And we've started now giving in that list to the ministry so that they can actually gazette them as vaccination centers. So by the end of next week, we'll have finished giving that list, and we'll have close to 3,000 or even more, because you find that I'm finding in the counties the people now have already accepted that the vaccine is the way to go. Initially, we had a hiccup where people were not even accepting to be vaccinated. They had all maids. We have already passed those maids, and acceptance is very high. And we are finding people coming and lining up and having saying the sun and saying that we want the vaccine, and the acceptability is very high right now. So the only thing now we need to do is to make sure that we provide more spaces for vaccination. We make sure that the vaccine is available, and we also communicate the areas where the vaccines are being administered. I think once we do that, it will be easier even to reach the 20 million mark by end of this year.
Something that I'd like to find out, all these plans are all good and well, but how informed are the would-be recipients of the vaccination? Are they well informed about where they can go to get the vaccines? Are they well informed about the possible side effects of the vaccines? Are they well informed about the types of vaccines or the similarity of the vaccines, the efficacy of the vaccines? In short, I'm asking, how prepared are we to communicate comprehensively to our citizens about the vaccine?
Thank you very much, Muga, for that question. And let me say that our vaccination program has gone through a number of phases. In the first phase, it was very well, it was targeted. Healthcare workers, frontline workers, security, and therefore the message was not a generalized message. We then brought on board the senior citizens, 58 years plus, but now we've expanded that to say more than 3/4 of the deaths are occurring in 50 years, so now we are vaccinating 50 years plus. We've brought in now the hospitality sector. We've brought in the transport sector because we want those parts of the economy to open up. Now, that is the exact reason. What we are going to do is now this communication campaign. And this is what we were launching yesterday, Pata Chanjo, Ka Chonjo. this is now we want the message to start reaching the people. We have the vaccines. We had this challenge that we could have hyped this earlier, but the vaccines were not there, and people would have really come and told us, you are telling us to be vaccinated, you don't have. Now we have the vaccines. We have a very clear communication campaign. Among the things we are going to do is to even identify local champions within communities who are really going to engage the communities, and this will really be the counties doing that. And secondly, where we want to use the media, the vernacular radio stations are now going to be a lot more active. We are partnering with the UNICEF and other people to really push this, and also the government is putting in money, especially for vernacular radio stations. We are going to put a lot more efforts there.
Because the target essentially, or one of the more important targets, is rural areas, whereby people might not get the information as to where they can get vaccinated. I can see that. And also then the importance of vaccination right now. What's the message around that? Because there's been a lot, kind of like what Honorable Mbai said a few moments ago, that there has been a lot of speculation about whether I should or I shouldn't, whether I should go for this vaccine or another. So, and then people have become mini scientists in their own right. So what are we saying now in terms of, are we saying, look, the best vaccination is a vaccination and you should go for it? Or what is that message concerning that speculation?
The message we have is that if you are eligible, and now eligible here means anybody above 18 years, because that's where the vaccine, you need to get vaccinated. We have moved from the stage where people are saying these vaccines are experimental. In fact, in my view now, anybody trying not to get vaccinated, they're experimenting on themselves and it will be disastrous. So we are telling them, right now, it is you get the vaccine. And what I've seen, I think the hesitancy, a little bit of hesitancy which was there at the beginning, quite often was not informed on the benefits of the vaccine. And we are telling them that the vaccine prevents severe disease. That is why they were given emergency use, because it's severe disease that will lead you to hospitalization and lead you to death. One of the things I've seen in this country is that, people try to equate a vaccine to a medicine. So they say, let me wait until I feel I'm sick, then I'll go for the vaccine. That is not the case. You need to be protected in advance. And let me just give, before Kisumu, the Nyanza region and Western had a wave, actually 2 weekends before that, some of the leaders at the health sector were telling me, vaccines are not moving, we want to give you back. And we were preparing how to recall them and take them to where, because demand is very different. Right. But 2 weeks down the line, their beds were full and now they were asking us, bring more vaccines. So for me, I think at this time, even as our curve is going down, this is the time to get vaccinated, because this pandemic is coming in waves. We want a lower wave this time than the fourth wave.
Right.
Yeah.
Dr. Mbai, Dr. Mwenda, rather, you represent the religious healthcare providers, but also because many people look, when they're coming to that facility, they actually look at it differently. They don't look at it as a private healthcare provider. They don't look at it as government. They have that direct line with religion. Many have been using religion as one of the reasons for vaccine hesitancy. What are your facilities and your network doing to champion uptake of these vaccines?
Thank you very much for that question. Our health facilities have been providing the correct messages that have been developed by Ministry of Health, the team that is leading this effort. The good thing now, we have the Interreligious Council, which is also providing messaging and keeping updating the religious fraternity regarding the importance of maintaining COVID prevention measures, including prioritizing taking vaccine. And we are leading by example, not only being vaccination centers, but also being on the forefront in receiving the vaccination. But we are all Kenyans, and just like Dr. Akhwale has said, we need to keep reinforcing the message. We need to step up communication with our health workers being in the front line because they have more information. But we have to be guided by the messaging that is being packaged by Minister of Health because it's simple, it's accurate, and the good thing, there are also contacts where you can reach out to get clarification on any issues you have. And we need to work on a system that will enable us to reach people even in their places where they live, where they go for worship, where they have their work activities, so that there's that dialogue, and addressing issues that individuals may have regarding the understanding of the vaccine. But we want to encourage our government to keep talking, keep reinforcing the message at every opportunity. Thank you.
Even as you say that, Dr. Mwenda, previously we saw that some parts of religious organizations had sent out a different message when it came to vaccinations. Has that messaging been quashed by what is currently happening? And for those who may have latched onto that messaging about being anti-vaccinations, how then are you able to deal with that communication for those who may have swallowed it up previously?
We appreciate the leadership that has been provided by the Interfaith Council, and what we're encouraging all religious institutions is to take guidance from the message that's coming from that team that was mandated to engage on their behalf, but also directly from Minister of Health. The Christian Health Association of Kenya, where I serve on my full-time job as the General Secretary, we even have a program on disseminating messages of hope around COVID-19. And that's not only disseminating the accurate messaging about COVID, but also dealing with myths and misconceptions. So initially, many of us were misinformed about vaccination because we were reading what we were seeing in the social media and the international media as vaccination started. But there's been a lot more progress. So we want to keep providing the accurate information now that the vaccines are here and they are accessible very close to where they live, in institutions that they go for services and they have confidence in. And I think with that ongoing engagement, people get better informed and they change around. I think this is the kind of journey we went through when HIV came to this country. And from when it started to where we are now, it's a complete, different perspective.
Sure.
Thank you.
Are you in Kenya? Are you an adult? Are you above 18? Have you been vaccinated? The message from the government is go out and get the COVID vaccine. And the tagline is Pata Chanjo Ka Chonjo, right? Pata Chanjo Ka Chonjo. In the room this morning is Eric Latif, Ndu Oko, CT Muga, and Dr. Willis Akhwale, the chairman of the COVID Vaccine Deployment Task Force. Joining us on the line, Dr. Samuel Mwenda, chairman of the Kenya Faith-Based Health Services Consortium, and Dr. Joseph Mbai, the chairman of all the CECs for Health caucus countrywide. We are talking about the government's plan to have at least 5.8 million COVID-19 doses administered within the next 20 days. So far, Dr. Akhwale has told us the latest statistics that he's seen, 3.8 million doses have been administered by this morning. So we are looking at a target of 2 million administered in 20 days. That is quite a drive. The idea here is Pata Chanjo Ka Chonjo. To get all this working, you're increasing the number of vaccination posts from the previous 800 to about 3,000. And that's where Dr. Mbai comes in, and also Dr. Mwenda, in providing the facilities and also the personnel to administer the vaccines. But at the same time, I heard Dr. Mbai, you say that this is the time when you are giving the ministry the number of health facilities that are available, and you hope that by the end of next week, then those health facilities will be declared. That will be 7 days into the 20-day period. Don't you think that's already working too close to the target?
You see, what is happening right now is that those vaccination centers are already doing the vaccination. The only thing that they haven't done is, there's a requirement by the ministry for gazettement.
Yep.
But we have already started. For example, now in my county now, I have already 80 vaccination centers that initially I had 24. So you can imagine I've added up to 80. And then I have 42 outreach centers, which are not they are not health facilities, but there are our vaccination centers that we have set up, which are linked to the gazetted vaccination centers. So the issue of the list for gazettement at the ministry is what may delay, but vaccination is going on. And for those outreach centers we are setting up, they are already vaccinating, and staff have been doing it, and we are getting vaccines from Dr. Akhwale every single day. Once we get depleted of stock, we are getting vaccines. So it's a process which is ongoing, and we are doing this because we need to make sure that we have that data. And I think when we were in Nyeri, that is what we agreed with the team of Dr. Akhwale, that we start the vaccination, and then we can be doing the vaccination as we send the data later. So the vaccination is going on. So we are not late, because activities are already going. And then there's a question you had asked about awareness, whether the people are aware what are the side effects and such. This communication has been given, and even what my health workers are doing, and that is what all the other counties are doing, when people come for vaccination, before the vaccination starts, they are actually educated by the healthcare workers right at the site. They are informed what are the possible side effects, and we also keep them for about 15 minutes just to check whether there are any adverse events that may arise after vaccination. So for that we have no problem. Then in terms of awareness, we are even announcing in churches. I know Mwenda will tell you that the churches are really helping us in terms of dissemination of information, because every Sunday there is an announcement of where is the vaccination center nearest. So the Christians are able to be told, if you go to this place, you will find. And we are also using radio. We are also using the community health volunteers who normally go door to door. And they are the ones actually who are bringing up the old ones. And then yesterday, after the launch of mobile clinics, we are also setting up, each county will set up a mobile clinic which can reach the ones who cannot be able to move, so that we are able to vaccinate as many as possible. So 20 days, I feel that it's doable. It's a target we can achieve in the counties, and especially even for Kirinyaga County, where the Mashujaa Day will be. I think we have scaled up seriously, and as a neighboring county, I'm also supporting them to vaccinate as many people as possible, and that will be achievable.
I applaud the efforts, but I'm going to be a bit niggling on this matter. When you say that the plans are underway, and I like the outreach program that you've outlined, are you saying that every county in this country have the same understanding of what ought to be done, and that they're all doing the same thing towards, so that you can all achieve this one goal?
We had a meeting last week, and we gave that information. And as the chair of the CC caucus, I have a meeting with the CCs to update them every Monday. So the counties are well informed. They know what we are supposed to be doing. They have been given the vaccine, and that will be achieved.
You know, Doc, we're coming from with the background of there are some counties, even in all the campaign drives so far, that were lagging behind, that are not doing very well in terms of the number of people vaccinated versus the vaccines that have been taken to them. What is being done in those counties to change the table, to improve their performance?
Okay, what I'm saying is that once we had that meeting, we gave responsibility to the CECs in charge to take charge of their counties. Because, for example, me, when I sit in Muranga, I will make sure that happens. If, for example, a CEC in Wajir doesn't, or in another place doesn't make that happen, then that one now becomes a personal responsibility. But as a country, we have given that information. All the CECs are aware. So if there's one which will lag behind, maybe that would be a disadvantage to their people, because we will still continue vaccinating in the counties that are serious and uptaking. But the ones that may lag behind, then we are flushing those out, and we are sending teams to the ground to make sure that that doesn't happen. And we are doing evaluation every end of week. So by the end of this week, which is tomorrow, maybe we'll be knowing how have we vaccinated this week, which county has been left behind, and how do we assist them to move together as a country. So that we are doing.
You know, Dr. Mbai, one of the things that, again, I must speak positively about are the efforts that are being made. However, efforts don't always translate into the desirable action. This is why you see us harping on this very same point. Because you say people are told or given information in churches. Excellent. It's a very good avenue. There are very many people who don't go to churches. But those aren't my worry. What about those who have issues with vaccines? People who don't necessarily feel that vaccines are safe and they need to be communicated to and they need to be convinced. How are you going about communicating this same message to these people?
Okay, you see, when we have apathy on a vaccine in a certain group, and I've seen that happen even in my county in Muranga, we give clear information on what is the importance of the vaccine, and we also tell them the vaccines that are available, the different types, all of them have the same efficacy, because we are finding the apathy could be even to a certain vaccine. Somebody would say, me, I don't want AstraZeneca, me, I don't want Moderna, me, I want J&J. But we have been able to convince them and probably inform them scientifically what is the essence of having that vaccine. And because I don't think there's anyone now who haven't seen a person who has been affected by COVID and what has happened, including the number of deaths that have gone into that. So we've continuously given that message, and we haven't seen somebody who have come out saying that, me, I don't want to be vaccinated. What they normally do, they will post in social media, they will ask funny questions, but for the ones who have come out and they were saying, okay, me, I have a problem with this certain vaccine, I'll wait for this one. We have been able to convince them, and they have taken what is available. But that point is well noted. I think we now, as a government, we really need to go out there and probably see those ones now who are the ones who have apathy. What do we do with them? But for right now, my concentration would be very much on the ones who are available and the ones who are willing to be vaccinated, so that I am able to vaccinate as many as possible.
Dr. Akhwale, can you talk to us a little bit about misinformation?
Yeah, so thank you very much for that question. And there are two things that really worry us. The first one was the whole issue of misinformation, and I'll touch on something also called disinformation. And misinformation is people just not having the right information about these vaccines. From the beginning, how do the vaccines work? Of what benefit are they? Do they cause infertility? Are they going to cause death? And we get people putting on social media, in 2 years, people will be dead. Already more than close to 2 billion people have been vaccinated. So, and then the issues of side effects, that if you get this, ABCD will happen. So misinformation and giving the right information about how the vaccines work, what benefits there are, is something we really want now to be spread down. We've come up with a deployment plan that guides on how that can be done. We expect at community level to have champions who are able to pass this information in the local dialect. But then there's also what we call disinformation, which in other words is propaganda. It is people who already know this is the case, but they will go and tell you it actually causes infertility. And to me, that is extremely worrying. And it is the disinformation that are currently we must fight. But then there are also where we have even the professionals themselves not passing very clear messages to would-be recipients of the vaccines. As you know, in this country, we are very worried about the uptake among the elderly. Those above 58 years, we wanted to vaccinate 2.6 million of them. Only 10% of them now are fully vaccinated. And we've been getting reports, for example, stating that some of the healthcare workers, when somebody has diabetes, hypertension, or cancer, and the patient just asks, should I really get this vaccine? The health workers are not forthcoming to encourage them to take. They themselves are being hesitant. And then that is where we have a problem. We want to be very clear that the vaccine, in fact, is most helpful in people with underlying medical conditions, those who can develop complications. So this should be the first on the queue. And that is why we have actually given now guidance that as elderly people attend clinics, let the vaccines be there so that they are vaccinated.
Still going to the issue of the elderly, Dr. Akhwale, there is the issue of then registration. There's a requirement to register on the Chanjo, and this is the online platform. Now, the same elderly persons, what kind of assistance should they be getting? Because one of the things that we are hearing from the ground is people saying, okay, I'm required to register on some platform and I don't have access or I don't have the know-how to register.
Yeah, thank you. The reason we are actually using the registration module is to help us plan better, is to help us focus. Remember, we are not in the situation where we have sufficient doses. We want to know where to take doses where there is demand at this time in our vaccination program. And also to manage the second dose so that once you are vaccinated, we keep for you the second dose to be fully vaccinated. Now, the issue of registration, there are three ways of doing it. The first one is self-registration, but we have also what we call assisted registration. And assisted registration is like for you registering even for your parents. Actually, we want the young people to use their smartphones to register for their parents. Then the parents can go. We can also have assisted registration by the health worker. So community health workers can take details and they take to the nearest post, and then the health workers register them into the Chanjo system. So the issue of assisted registration is available.
On that last note, for community health workers, isn't it something that ought to be deliberate? That they, I mean, can we have, or is it possible, or is it being done right now, that you have a go-to system, that you're actually going from, the way the polio vaccination happens, that you're going from door to door? Because to say that you find your nearest community health worker and then register, I am sure it's not going to happen. But if you have people going and saying, look, I mean, I guess it could be part of this, going and saying, have you registered? If you haven't, we can assist. Because this also is an online portal. We can guarantee also that many people do not have access. So in terms of it being deliberate, the CWH goes, the CHW goes to people and registers them, and then, you know, almost as though something that will be deliberate and proactive.
Yes.
Exactly what we launched in Kiambu yesterday is exactly what you've described, and that's how we want to work. Because we want them to tell us where are these people so that an outreach is more informed. So they will go, they will identify, they will take the details, and once they enter in a Chanjo system, we will know the next outreach. We have 500 people around this region, and that's where we are going. Yeah.
Okay.
So it should be deliberate. Well, Kiambu has done it. I hope the other counties, best practices are very good to learn from. So we hope that the others as well learn from that.
In terms of a supply issue, and this is also something that we get to sometimes get worried about, that could essentially feed into then what Dr. Mwenda is doing, and then to feed into what Dr. Mbai is doing. In terms of a national supply, are we at a place whereby we will not have an issue if we run out? We're still... Those that have been bought by government have not yet fully come into the country. Those that have been touted by donation also are not complete. And then we still have these numbers and these targets. What assurances do you have that we're not going to get into a place where these campaigns are rolled out and then we don't have the life?
Okay. No, and that's a very fair question you ask. And I want to start by saying the stage up to December, we are seeing an improving situation. But we have looked at the period from January next year is when we'll have sufficient doses to really ensure that the supply chain is consistent. But even with this improving situation, we are testing our systems. And for us now is what Mbai said, where there's demand is where we want to take the vaccines so that they are reached. Remember, number one, the vaccines also have very short expiry by just the nature in which they are and the way we are now getting them. So we will not put them somewhere and be waiting until people start coming. We will quickly move them to where the demand is. That's first and foremost. And then secondly, I think what Mbai said, we are now determined that at the end of every week, either Friday or latest Monday, to publish how the counties are performing so that Kenyans can see how efforts are leading to increased numbers. So we are going to really have a list and show who is the top performing and those who are not top. But more important, I think, strategies can be different. And that question has been asked. We for example, the semi-arid areas, we've actually approached the Red Cross and they are very kindly decided to take, 7 counties in the northern area, and they are going to support reaching out to the mobile population.
Okay.
Yes.
Doc, there was a news article recently with regards to the donations of Pfizer vaccine from the USA, that they arrived, but they didn't come with the syringes that go with them. Has that been addressed? Because we've seen also yesterday there was a new batch of Pfizer vaccines that have arrived from the USA. Are they available in this campaign?
The syringes will be shipped tomorrow. They'll arrive here in Kenya on Saturday. They are huge consignments. They will arrive both on Saturday, Sunday, and Monday. And therefore, from Monday, Pfizer vaccinations will begin, or latest Tuesday, in some other regions in the country. Now, the reason as to why that occurred is that Pfizer as a vaccine is put in what you call a multi-dose vial. And the amount of vaccine that you have to draw required a special syringe and needle. Now, but the main reason that they delayed is because Pfizer, the vaccine itself, the packaging and the way it is specialized, the U.S. government, when it's giving a donation, it can use one partner. In Kenya, you saw it came by DHL, but the accessories are being brought through UNICEF. So UNICEF was bringing that. For us, we saw it as 10 days will be adequate enough for us to have already distributed the Pfizer doses. So yes, we regret for 1 or so week delay, but come next week, Pfizer people will be vaccinated.
When you talk about the the uniqueness of the syringes, are we saying then that the healthcare workers will have to be trained in using them?
They were trained. They were already trained. We actually, you may have realized that the first 3 weeks of September vaccination was slow, is because we targeted to train 3,000 health workers on all the 5 vaccines because they all are administered differently. So they have been trained on Pfizer. They are ready to start administering Pfizer. They have been trained. They were shown the syringe. They were shown how it works. We had samples. So they are very, very clear on them.
All right. Thank you very much, Dr. Willis Akhwale, Chair of the COVID Vaccine Deployment Task Force. Joining us also on the line, Asanteni Sana, Dr. Samuel Mwenda, Chair of the Kenya Faith-Based Health Services Consortium, and Dr. Joseph Mbai, the Chair of the National CEC's Health Caucus. We wish you all the best as you roll out this particular campaign. 2 million vaccine doses to be administered in the next 20 days. The target is to have
100,000 a day.
100,000 a day.
So yesterday we did close to 70, so we are moving.
Okay, so it's possible. Have you been vaccinated? Are you an adult 18 years and above in this republic? Pata Chanjo, Ka Chonjo, that's the campaign. A COVID-19 vaccine is available and the government is saying we are rolling it out. We are increasing the number of places where you can get this in public facilities, in private facilities, and also in the faith-based facilities. Asante sana.
This is the Situation Room, the only way to start your day.